Hi, I'm going to talk about the evidence for the common to human transmission of MERS or MERS coronavirus. The MERS coronavirus is a newly identified human coronavirus that has recently emerged in the Middle East region. Current epidemiologic data that suggests multiple zoonotic transmission from an animal reservoir leading to human infections, sometimes with secondary transmissions events in humans. The coronavirus MERS. The Middle East Respiratory Syndrome, this is MERS, is a new viral respiratory disease to humans. Science was first reported in Saudi Arabia in 2012. MERS has caused serious illness and even death of people from various countries or different countries.
Coronavirus infection in the UK brings the number of global cases up to 12. So this potentially fatal SARS-like virus was first identified in September of last year, and experts now say they would not be surprised if it came to the U.S. Senior medical correspondent Elizabeth Cohen joins us now. So Elizabeth, explain this to us. How dangerous is this?
You know, this virus is particularly vicious, John. You talked about 12 cases. Well, 5 out of those 12 have died. That's a relatively high mortality rate. People are getting things like pneumonia and kidney disease. But, and here's an image that we got actually right from the authorities in the United Kingdom. So that's the bad news about the virus. The good news about the virus is it's actually hard to get. It's thought that people are getting it from animals, but then once it gets to people, it's not spreading, from what we can tell, person to person to person to person. You're not seeing long chains of transmission like you do, for example, every year with the flu. It is possible that there has been some person-to-person transmission, but it's been very limited, and so far they think that they've only seen it among people who are living in the same household. So, for example, they're not seeing people getting it by say, sitting next to a sick person on an airplane. So that's good news. Bad virus, but also really hard to get.
Elizabeth, we did call it a SARS-like virus here, and that doesn't sound good. So talk us down here. How scared should people be about this?
You know, the experts I talked to said people should not freak out. Those actually were their exact words. They said, again, we're not seeing, say, someone get on a bus and then the rest of the bus gets sick. That's not what's happening. What we have seen so far is that this appears to have started in the Middle East, and now we're seeing these few cases in the United Kingdom. But again, you're not seeing long chains of person-to-person transmission. Now, these same experts said, you know what, wouldn't be surprised if it came to the United States, given the high volume of global travel, but it is possible.
Global health officials have questions and concerns as well about a newly discovered virus called the novel coronavirus. Cases have been reported across parts of the Middle East, especially Saudi Arabia, in Britain and France, where a person who shared a hospital room with an infected patient has now tested positive as well. That's worrying. Senior medical correspondent Amy now. So if a person sharing a hospital room with someone who's infected develops the disease, does that suggest that it's going from person to person, yeah?
Well, Hala, we already knew that it was going from person to person because there was suspicion that family members were getting it from each other. So while hospital mates are not family members, they are living in the same room. So again, they suspect that they have seen this virus go from person to person among close family members and now also in the hospital setting. So while that's certainly worrisome, I would also say we're not seeing it among people who, say, sit on a bus next to each other for 15 minutes or pass each other in an airport or are shopping near each other. You know, I think that's an important distinction to make. And when you see these numbers, I think you'll see what I mean. So this virus was first identified in September of 2012, and there have been 34 infections since then. 34 known infections, I should say. If this were spreading like wildfire, we would have seen a whole lot more since it's been around since September. However, here's the number that I think doctors are finding especially troublesome. 18 deaths. That is more than a 50% death rate. That is very high. So when people do get infected, it appears that they get very...
Okay, the researchers have found MERS coronavirus in several countries, camels, and Abad in Saudi Arabia. And Arabia Saudita. No one knows if camels are the source of the virus. Studies continues to show evidence that infection in camels may have had something to do with MERS coronavirus, to do with the MERS coronavirus infections in the people.
Camels might be the source of the deadly MERS, or Middle Eastern Respiratory Syndrome, coronavirus that started affecting people last year. The virus has infected 94 people, and almost half of them died as a result. Exposure to animals that have a virus is one way that it can be passed to humans. Researchers from the National Institute of Public Health and the Environment and Erasmus University in the Netherlands looked at blood samples from many livestock animals, including sheep, cows, goats, and camels from different countries. Dromedary camels from the Canary Islands and Oman were found to have low levels of the antibodies that are similar to the MERS virus, which indicates that they might have carried the virus at some point in their lives. Although this data is a lead to find out where the MERS virus came from, Professor Paul Kellam from the Wellcome Trust Sanger Institute in Cambridge and University College London said the definitive proof would be to isolate the virus from an infected animal or to be able to sequence and characterize the genome from an infected animal.
And the symptoms of the coronavirus, the MERS coronavirus, most people infected with this virus had severe respiratory diseases. They had fever, cough, and difficulty breathing. Others say they had gastrointestinal symptoms such as diarrhea, nausea, or vomiting, or kidney failure, kidney diseases.
Coronavirus that's causing concern around the world. It's extremely rare but deadly, and now scientists believe it can spread through close personal contact. In northern France, 2 men are being treated in intensive care. A 50-year-old man contracted the virus after sharing a hospital room with another infected patient. The World Health Organization is investigating other cases like this in the Middle East.
Of most concern, however, is the fact that the different clusters seen in multiple countries increasingly support the hypothesis that when there is close contact, this novel coronavirus can transmit from person to person.
So far, there have been 34 confirmed cases of the virus since it emerged last year. Of these, more than half of the patients have died. Most of the infections have occurred in Saudi Arabia and in a number of nearby countries, but the virus has since moved further afield into Europe. It causes a high fever, breathing difficulties, and can eventually lead to organ failure. Experts are now racing to find the source of the virus and to learn more about how it spreads. In its current form, it's not contagious enough to start a pandemic, but with its high fatality rate, it's a threat that health officials are taking seriously. Rebecca Morrell, BBC News.
This new case of MERS apparently was passed just by a handshake. Does that change everything we think we know about this virus?
It could, Anderson. There's a couple of important caveats here, but when we think about this virus only spreading through close contact, what we typically mean is healthcare workers or family members, people who have prolonged contact with a sick person. What's, I think, very important to point out, and you may have heard, is that this new case was someone who did not become ill. They weren't sick. They were screened because they had come in contact with someone that was known to have the infection. they didn't become ill themselves. And also, they didn't find the virus in this third person's body. They found what are known as antibodies. Antibodies are sort of a clue that the virus had been there and the body had fought it off, but they didn't find the virus itself. So what's interesting here, Anderson, is there could be a lot of people like this who've been exposed to MERS, never got sick or got really mildly ill, and as a result never visited their doctor, and that could potentially be good news. That might mean that this is not as serious or as deadly as we have thought.
So what are the symptoms that signal someone could be infected?
It starts off looking very much like a cold. I mean, people may develop fever, some cough, difficulty with breathing. It can progress into more significant pulmonary, respiratory problems, and also kidney problems. And that seems to be what's causing death in about the 30% of people who are documented to have died from this. But it's, again, you may have a broader spectrum. There could be people who just have a little bit of fever, a little bit of cough, and then people who get really deathly ill.
I mean, I had read, though, that a third of the people who'd contracted MERS, that they have died, but you're saying that statistic may not tell the whole story.
This is interesting math, and this comes up in public health all the time. The first numbers that you hear with something like this hardly ever are the complete story. So we crunch the numbers. About 614 people have documented infection, 180 have died. That's about 29% mortality. Scary number. But those are the people who got tested because they were sick and they were of concern. If there's a lot more people out there, Anderson, who have been exposed to the MERS virus but only had mild symptoms or no symptoms at all, maybe the denominator isn't 614, but it's 6,000 or even 60,000. If that's the case, and 180 people have died, the mortality comes way down. And that we've seen that before. We've seen it with other viruses that we thought were far more deadly when we initially looked at them, but then we realized it's affected a lot more people, many of whom didn't get sick or got just mildly sick.
Well, I was going to ask how can people protect themselves, but from what you're saying, I mean, you don't want to give the sense that this is something everybody is going to come in contact with and therefore needs to protect themselves from. So what should people do, if anything?
The basic rules still apply, with regard to, you hear about this particular case, a sick person shook hands with somebody, and maybe as a result the person became infected. The basics apply. Washing your hands, obviously, not touching your hands to your eyes, your nose, your mouth.
What is it, singing happy birthday while washing your hands?
Yeah, singing happy birthday twice.
Twice, okay.
Twice, just to make sure, you got to be doubly protected here.
All right.
Twice, just to make sure, you got to be doubly protected here.
Okay, thank you.